Hello, I'm Anna Hayes from the UK, England. I use the reflexes quite a lot when I'm treating with Ortho-Bionomy, but I think my favourite is to use the follow-on response to treat the neck and the spine. We've all learnt the phase 4 techniques for treating the neck, but I think many of us quickly forget the specific details of these techniques. Do we rotate the head towards the point or away from the point, depending on where on the neck we're treating? Do we slide the head in relation to the vertebra, or do we rotate the head? If we're sliding, do we slide to the point or away from the point? And do we have to rotate the head after the slide or before the slide? These techniques for me never felt as if they were following the path of ease and comfort. I found myself working more and more with phase 5, with my client in a deep state of relaxation, and I didn't want to disturb them to start positioning the head and the neck to fit the phase 4 techniques. If I'm going to be working with the neck, I will have already completed a balance of the shoulder blades. I will have checked the position of the clavicle, and I will also have possibly gone through each of the shoulder points using a balance reflex. I then start working with the upper thoracics, and I do that by sliding my hands underneath the shoulder blades and rotating my hands, and usually my feel fingers, the middle fingers, will then land on T5. And what I do is I very, very gently test the rotational movement of T5. So I'll press up a little bit on one side, up a little bit on the other side, in order to identify the free direction for that vertebra. Once I've identified that, I will then complete the follow-on response. So for example, if it's easier on the right-hand side, I'll be going 1, right, come back to the central position, 2, up on the right, come back to the central position, and then wait for the follow-on response to happen. Once that's completed, I work my way up the upper thoracics from T5, T4, T3, T2 and T1, working with a follow-on response if necessary on each of those vertebrae. When we get to the neck, we have the possibility of testing the rotation of the vertebra as well as the translation of the vertebra. And I will work up from C7 up to C3, testing the rotation as well as the translation if appropriate, and if necessary then using a follow-on response to treat each of those vertebrae. With C2 it's a little bit different. I will then find the transverse processes of C2, which you can just about feel underneath the occiput. And I will then use just a phase 5 response. With the atlas, you can obviously test the translation and use a follow-on response with that. The client only experiences the gentle, very gentle movements of the testing and the reflex, and so remains in a state of deep relaxation and self-healing. I will treat the lower thoracics and the lumbar vertebra in a similar manner, but with the client lying on their tummy. So again, I'm testing each vertebra for the rotation, so pressing down on either side of the spinal process very gently to see which direction is free, and then using a follow-on response if necessary. And in this way, you can gently treat the whole spine, working up vertebra for vertebra, whilst the client remains in a state of deep relaxation and self-healing. I find this a beautifully elegant way of treating the spine and the neck, particularly for those patients in severe pain, as any extraneous movements can cause pain and tear them out of that state of relaxation and self-healing. So that's the way I treat the spine and the neck. I've done it this way for years now, and it works beautifully. Hope that I can inspire you to do the same. Thank you.